When you walk around the streets of Sweden's capital, Stockholm, it's hard to see the signs of the fight against COVID-19. People here seem to be going about their business as usual. Shops, restaurants and schools have remained open throughout the pandemic. And face masks are really rare. The country's strategy has intrigued and even shocked many around the world. But most Swedes will tell you a total lockdown wouldn't have helped either.
Then we have economic problems and people sit there, they can't pay their rents, their bills, and they get very depressed, so that's not good either.
A lot of countries coming around to seeing that there's no such thing as a total lockdown doesn't really work.
Plus, Swedes will say life here did change. Sweden banned gatherings of more than 50 people and asked residents to work from home when possible and to observe physical distancing.
But I think most people really try. I mean, you can see it the way we walk on the pavements. I mean, we don't walk straight anymore. We go almost in circles sometimes, try to avoid people. And so I think we're trying to take care of each other.
Sweden did register nearly 90,000 infections and more than 5,000 people died from the virus since the beginning of the pandemic here. The country's toll is significantly higher than that of neighbors Denmark, Norway and Finland, but remarkably lower per capita than some other countries that imposed harsher measures across Europe. I met with the architect of Sweden's no-lockdown strategy to ask if its relative success can be sustained.
This is not a disease we're going to get rid of, so we need to keep it at a manageable level. And right now it is at a manageable level in Sweden because the hospital system does not have many cases anymore. Long-term care facilities are basically spared from any kind of spread. So in general, this level of spread is fairly acceptable until we have a vaccine in place and hopefully can change it to something even better.
But for those living with the disease, Sweden should not be claiming victory.
And I think we should have been faster in recognizing what a serious threat this was.
Emma is part of a group designated as the long haulers. She was diagnosed with COVID-19 6 months ago.
6 months that you've been ill?
Yes.
And today, for example, what do you feel? What are the symptoms you...
Well, the two main lasting symptoms for me has been the elevated pulse and breathing difficulties. And today is a good day, so walking like I was walking with you would not have been possible on a bad day. Then I would have to stop and catch up on breathing.
Sweden may be faring better than many when it comes to the fight against coronavirus long term. But the country will certainly not leave the crisis unscathed. Annelise Borges, Stockholm, Euronews.
And Annelise has remained in the Swedish capital for us, and she joins us now. Good morning to you, Annelise. Sweden's approach is widely welcomed inside the country, but there are still people who do not agree with the tack that the Swedish government has taken.
Hi there, Oliver. Well, absolutely. Like elsewhere in the world, Sweden's strategy has not been unanimous. There are people here who think the government should have done more to help to protect the public. But while they think stricter measures were in order, very few Swedes will tell you that they would have supported a total lockdown, for example. What critics here focus on is this perceived strategy of herd immunity, which is when a large part of the population comes into contact with a disease and then becomes immune to it. Anders Tegnell, the chief epidemiologist here in Sweden, told me that that was absolutely never part of the plan. What authorities trying to do here in Sweden was to control the spread of the virus so that the healthcare system here in this country could cope.
Now, what did he have to tell you specifically about masks? We've seen in Europe there's now more of a shift for people towards wearing masks, especially here in France, in the UK, it's becoming more normal. Why is it that in Sweden people do not have to wear them?
Well, Oliver, I asked Anders Tegnell whether or not masks simply did not work. And his answer to that was, we don't know. We don't know if masks are effective or if, on the contrary, they would give people a false sense of protection. So at least for now, he insisted that authorities will not be asking Swedes to wear face coverings. And that blunt, clear way of speaking to people, to the public, seems to be part of the reason why the Swedish strategy has been working so far. It's not uncommon to see Tegnell on TV talking about everything that is not working in the fight against coronavirus. He has repeatedly said that the government should have done more to protect the elderly in care homes, for example, where half of the coronavirus deaths have been registered here in Sweden. So that blunt way, that clear way of talking about even what they do not know has kept people engaged and participating in this fight. But when it comes to fighting a second wave of the virus, well, he was as realistic and as blunt as often he's perceived to be. Tegnell told me that there will be more cases of coronavirus registered here in Sweden, but that the strategy will remain the same, to try and slow the spread of the virus so that hospitals and care homes can cope, because according to Tegnell, the coronavirus, this pandemic, is not going away anytime soon.
Annelies Borges joining us here from Stockholm. You might just have to make way for people getting off that ferry just behind you. Thanks very much, Annelies. And as we just saw in Annelies's report, some people who contracted COVID-19 are still feeling its effects many months later. To discuss these cases, I'm joined by epidemiologist Daniel Lopez Acuna, who is an adjunct professor at the Andalusian School of Public Health. Thanks very much for joining us here on Euronews. Good morning to you.
Good morning.
Can you just explain to us, what are the most likely symptoms which persist for so long?
Yes, I think it's very important to understand that the majority of cases of COVID-19 are acute cases that are associated with a pneumonia that produces the classic symptoms of fever and coughing, and well, sometimes also the associated symptoms of not being able to smell or to taste. But there is a small group of patients that continue having problems associated to the inflammatory reaction to including the long-term effects of the respiratory troubles that have been faced, but also problems associated to the heart and brain damage that is produced, or the pathological reaction that is produced by COVID-19. So you can have a number of neurological symptoms and also a continuation of the respiratory symptoms for over a long period of time, not anymore with an acute infection that can be transmitted, but yes, as long-term effects of the COVID-19 pathological reaction.
And Daniel, how long could these after effects last for, or is it just too early to say at the moment?
In many respects, it's too early to say, because we have been observing, well, not very much time, not more than 6 months in some cases. And looking at the long-term effects needs a longer perspective to follow the cohorts of patients and to see what exactly happens. I mean, it's enough that we are observing that over the acute phase of 2, 3, or 4 weeks of having the respiratory infections, we still can have some weakness, some elements of, in some cases, stroke and or Parkinson, some irritability neurologically and therefore psychologically, and that we can have a prolonged shortness of breath and inability to have the fully fledged muscular strength that the person had before the infection.